Life Healthcare has been on the market. It was off the market, then came back in June 2010. It had a big RMB involvement. It came out of the old Afrox group. But it has been expanding not into developed world countries. It's been going into sort of more developing countries, which is, like India, for example, where it bought into something called the Max Group, as well as Poland. I don't know if it's fair to call Poland a developing country.
It's not quite developed.
They'd probably not like that. It's actually quite developed, although it's a market not dissimilar to ours, where there's an expansion of the private sector in the healthcare environment. 40.8 billion rands worth of market cap, so just within a whisker of Netcare. Price to earnings ratio 20.04, dividend yield of 4.12%. What stands out for you about these guys,
Big
Wayne?
investment into Poland and India, still to bear fruit. They emphasized it 10 times in their commentary that they've put 2 billion, I think, into India and can't quite remember, but probably an equal amount into Poland, and they've still got to reap the benefits of it. So they've, you incur the asset cost, you incur the interest cost, but you still got to develop these groups. Now, the Indian market, I don't know much about, but there must be huge potential there, and they're very, very positive about both of them. However, the current earnings are quite suppressed by these massive investments offshore.
Because presumably the model is just the same. Roll out the facilities, attract the top physicians, try and position yourself as a player in the market, which sets you apart from the state-owned thing. I mean, I imagine the hospitals in India are probably a bit of a mixed bag as well.
Yeah, I think so. And also they bought into an existing group in India, so there is already an established unit on established function happening there.
But here in this country, they've done well. I mean, they've rolled out all sorts of facilities. They've expanded them. They've gone into some secondary towns. They've been adding, oncology units, renal units, all over the place.
The South African healthcare market is doing extremely well.
Yeah. The other interesting thing about them is, remember, the CEO, Mike Fleming, was replaced by this guy, Andre Meyer, who came from the big medical aid administrator, MedScheme.
Okay.
So he was the CEO of MedScheme, which you'd think would be quite a good thing, because then he knows how the enemy thinks.
Yeah, exactly.
Because that's what it is in the hospital groups. It's basically you and the board of healthcare funders.
And surprisingly enough,
going 15 rounds to decide what you're going to be prepared to pay for X or Y or Z procedure.
And I mean, this weekend I had a chat to a friend of mine who's actually in this industry, and there's a whole sub-industry that checks the bills going from one unit to another unit to make sure there's no overstatement and is it all correct and what the tariffs are.
Indeed.
Must add to the overheads enormously, but yes, quite clearly.
Quite a lot of technology development happening there. One of our global investment portfolio options is to look at those IT companies that help these hospitals.
Because that's the case in America. I mean, you've got such strong records, and South Africa will eventually go that route.
Let's go and look at the chart, because this one reflects a similar sort of pattern. After it came to the market, did very well. It's gone a little bit off the boil, and I guess it's the combination of just anxieties a little bit about the local market growth criteria, although it did sort of grow into its PE a little bit.
Yeah.
Hot or not?
Man, it's actually a difficult one, because I like the story of the profit, the potential profit increases in Poland and India. But at the moment, I'll go not hot. Actually, I'll just sit back a bit.
Okay, I'm going to lean hot on that one, because I like the idea that they're going into markets that aren't aggressively overtraded like the UK.